At 4, it's a new year, and health experts say a new version of Omicron is now taking hold of the United States. With COVID-19 infections and hospitalizations growing after the holidays, health experts are now warning against complacency with this new variant. NBC4's Matthew Herchick has the story.
Well, this year will be the first new year since 2020 that the pandemic hasn't been front and center. But as we transition into 2023, health experts say as we head into the new year, it's still the old approach that's our best defense against COVID-19. According to the latest report from the CDC, the new COVID-19 subvariant known as XBB.1.5 now makes up about 40% of coronavirus infections nationwide. Begging the question, what do health experts know about the latest strain so far?
What we know about XBB.1.5, it is still an Omicron subvariant. We have not switched to the Pi variant. We know that XBB.1.5 so far evades immunity from previous vaccines and infections.
And like other up-and-coming variants, experts say XBB.1.5 is more transmissible.
Unlike other previous variants, we don't have monoclonal antibodies to neutralize XBB.1.5. So that is actually an important tool for some people who can't take Paxlovid.
In addition to drugs like Paxlovid and Molnupiravir, Ohio Health's Dr. Joseph Castaldo says heading into 2023, the new bivalent booster is the best way to protect against evolving variants.
And most concerning for me is under 40% of those 65 and older who are eligible to receive the booster have received it.
Experts say statistics showed that those 70 and above who aren't up to date on their vaccines remain the most at risk for severe illness from XBB.1.5. Though hospitalizations are rising, experts say we're nowhere near where we were a year ago.
During the peak of Omicron, for all of our hospitals, we had close to 750 patients in the hospital with COVID-19. Where we are now as a system with all the hospitals, it's a little over 100.
But as a new year brings new levels of COVID-19 fatigue, Dr. Castaldo says the most important thing in 2023 is understanding the tools available.
Have a plan in place. If you have an at-risk condition, if you're above the age of 65, have a plan in place to get tested and then to get the outpatient treatments that you need to keep you out of the hospital.
Dr. Castaldo reminds that as we head into 2023, the focus needs to be on how we live with COVID-19, not how we get rid of it. And for more information on the new variant and for health tips from experts, you can head to our website, NBC4i.com. Local for you in Columbus, Matthew Herchick, NBC4.
3 years into the pandemic, and yet another new subvariant of the coronavirus has emerged. As William Brangham explains, it's spreading rapidly and it's driving an uptick in new infections.
This new Omicron subvariant, known as XBB.1.5, now accounts for more than 40% of new COVID infections here in the U.S. and around 75% of cases in the Northeast. This new variant emerges while just over a third of Americans 65 and older, those at most risk for severe outcomes, have gotten the updated booster shot. As China deals with a massive surge in cases, this week the U.S. will require a negative COVID test from passengers flying from China to the United States. Dr. Jay Varma is a physician and epidemiologist. He's also a professor and director of the Cornell Center for Pandemic Prevention and Response. Dr. Varma, great to have you back on the NewsHour. So there are these various COVID alarm bells that are ringing. Cases are rising. Some localities are asking for masks to be put back on with some mandates. And now this new variant has emerged, XBB. How worried should we be about this variant?
I think it's important for all Americans to understand that, this is a very precarious time for our healthcare system. So we're dealing with new COVID variants. We're dealing with, potential surge in infections that might arise from infections around the world. And we still have influenza and RSV to deal with. So I don't think Americans should be unduly alarmed. This variant is going to be causing some of the similar ups and downs as we saw earlier this year. But at the same time, it's just yet another reminder about the importance of vaccines and high quality masks.
So the initial reports that had come out that XBB.1.5 might be more able to evade our immunity, either from vaccines or prior infection, those aren't as alarming to you?
So what's concerning is that similar to these other Omicron variants, it's going to make people more likely to catch COVID. similar to other variants, however, it doesn't appear that it's going to increase the risk of hospitalization and death beyond what has already happened in the past before. So again, more likely to get infected, but if you have vaccines and you have prior infections, you have similar level of protection. I think the other thing that is worrisome is, however, one part of our treatment arsenal, what was known as monoclonal antibodies, is no longer effective anymore. So it really leaves us only with Paxlovid, the one drug that's widely available, as our effective treatment option.
I mentioned the low booster rate for Americans. Beyond that, some places are starting to require masks, but as I've traveled around the country, and I'm sure you know this as well, most Americans are just not wearing masks and seem to have no interest in them again. I did see the mayor of your city, Eric Adams, was wearing a mask in a public space, an indoor space. I'm just curious what you think the government's position ought to be now with regards to masking.
Yeah, every time we think about public health, we think about, what works scientifically, but also what's acceptable and what's likely that people are going to do. And masks are the perfect example. We know that a high quality mask will protect you as an individual. And we know if lots of people do them, it can reduce the stress on our healthcare system. But we also know that a lot of Americans are tired of wearing them. So I like what's happening in New York, where elected officials are modeling good behavior, because we know that social norms are important, even if you don't have a mandate. The other thing I wish governments were doing is making high quality masks widely available, just like we have toilet paper in every bathroom. Doesn't mean you have to use it, but it's just yet another reminder, and reducing that friction so that people who do feel like they might want to wear one have one always available.
So separately, I mentioned, we know cases are surging in China, seemingly as they have somewhat done an about face on their zero COVID policy. And in response, the Biden administration says later this week, you need a negative test to get into the country from China. Administration officials say that this is a prudent and smart thing to do. One global health expert I talked to said today he didn't think it was going to have any real impact. What is your take on this?
Yeah, I'm pretty skeptical that it will have any public health impact. There is so much COVID transmission occurring, not just here in the United States, but all over the world. Most countries around the world have removed almost all of their COVID mitigation strategies. So even though, China has an enormous population that's at risk of getting infected over the next few months, I'm not convinced that that's likely to, change the burden of disease here in the United States.
As you well know, so much of the country seemingly has just moved on from talk of COVID or action against COVID. What should the government's response be in that case?
Yeah, it's a very natural human phenomenon. Trying to wear masks, get vaccinated, be cautious takes work, and work is exhausting. So I do feel that government has a responsibility to continue to remind Americans about how many people are dying every day, because it's important to stay up to date in your vaccines and to have masks and tests available when you need them. Just in my own personal life, I had dinner with my wife and a few friends at our home the other night, and they were not aware that 15 to 20 New Yorkers are literally dying every day for the past several weeks from COVID. So, I do think it's important for government to remind people. And as I mentioned before, to make tools such as tests, masks, and drugs frictionless so that everybody has access to them.
All right, Dr. Jay Varma of Weill Cornell Medicine, always good to see you. Thank you.
Great. Thank you, William, for having me.
CDC says a new COVID subvariant is causing a rise in hospitalizations. The federal agency reporting an Omicron subvariant known as XBB now accounts for nearly 41% of new cases across the country. Tarrant County Public Health is recommending masks yet again. Health officials there just raised the risk level to high community spread.
COVID cases are climbing. The CDC reporting over 400,000 new infections in the U.S. this week alone, and over 100 million cases have been recorded now since the start of the pandemic. Yahoo Finance's Anjali Kamlani here with the latest. And Anj, certainly alarming, concerning here, seeing this case count rise so quickly.
Absolutely. And we know that, of course, it is the winter season, so respiratory viruses, will take flight. We saw the triple-demic, really impacting hospitals earlier. So now with the new rise in cases, concerns about about what is happening in China in particular. Right now, we're looking at 100,000 cases, more than 100,000 cases per day as of yesterday, and that's according to the latest numbers. We do know that so far, no serious climate deaths, but we have seen hospitalizations. And then, of course, going back to what's going on in China, concerns about many different things. Number one, China not giving us the numbers of their daily cases. In addition, not really knowing whether or not the variants that are there that are driving the case rise are going to impact the U.S. It is important to note that we are still seeing some of those same variants here in the U.S., so it's not like they're not here already, but what the impact will be is still yet to be seen. As a result, the U.S. has joined many other countries in implementing testing requirements. France and the U.K. now joining that, and the U.K. just days after saying they would not be implementing any test on arrival situation. So all of that going into play for inbound Chinese travelers, and that is regardless of citizen status for here in the U.S.
The CDC has projected that about 40% of COVID cases in the U.S. are caused by this strain.
It's the latest variant of coronavirus that is now breaking through and becoming more dominant in our country. It's been streak after streak of different variants coming out, and this one was predicted early on that it might break through because of its characteristics, and now it is.
LifeBridge Health's Dr. Scott Krugman says it's not clear where this version came from, but it appears to be spreading quickly through the Northeast and is likely here in Maryland.
I would imagine, yes, it probably has, because our hospitalization rates are up higher than they've been since last February, and it's been a lot of people sick with coronavirus.
Dr. Krugman says the data is still out on whether it's more contagious or severe. He says the virus keeps adapting, changing, and evading antibodies.
What it can do is, if you have a prior original coronavirus vaccine strain or were infected in 2020, 2021, that's probably not very protective against this one. If you are affected with Omicron or have your bivalent booster, then you are probably pretty well protected, at least against hospitalization.
With this new strain, the advice is the same. Increase ventilation, wear masks in crowded situations indoors, and test before going to gatherings to help prevent the spread of infections. Also, get vaccinated and boosted. Lisa Robinson, WBAL, TV 11 News.